I'd like to introduce our first speaker, Zach Walsh. Zach Walsh, PhD, is a clinical psychologist and an associate professor of psychology at the University of British Columbia, where he directs the Therapeutic, Recreational, and Problematic Substance Use Lab. He has published and presently published widely on topics related to cannabis, psychedelics, mental health, and psychotherapy. He is the lead investigator for several ongoing studies of the therapeutic use of cannabis, including a clinical trial of cannabis for PTSD. Zach's clinical focus is on the application of third-wave behavior therapies to address relationship conflict and problematic substance use. Please welcome Zach Walsh.
Thanks so much. It's really exciting to be here, and really humbling, really, to be able to share the presentation stage with so many of my heroes. So I'm really excited to be here, and it's lovely to see you. I want to talk today, sort of a bit of a mixed talk. I'm going to present some data that we've published, some results that we've published, also some stuff that's in the works, and then present a little bit of a theoretical model of how I can see integrating psychedelic experience with some approaches to psychotherapy that I'm involved in. And I'm a clinical psychologist and a professor of clinical psychology at UBC. I did my graduate work in Chicago, and I spent much of my time there working in a jail in North Chicago. And that's where some of these data come from, and also really where I developed a passion for finding ways to end the incarceration crisis. I mean, there's certainly a lot of political ways to do that I think are most effective, but also just looking at how we can help people who have suffered through this incarceration epidemic and welcome them back into society. So I want to talk a little bit about that and how we might facilitate that. So yeah, prisoner reintegration. I highlight the word reintegration because it's a word we hear in the psychedelic therapy community, and also a word that is common to working with correctional populations. So I want to talk a little bit about reintegration and how we can maybe merge those two forms of reintegration. I'm going to talk about some of the first wave findings. It's not new to imagine that there may be ways to facilitate reintegration and work with correctional populations using psychedelics. So I want to talk a little bit about some of the initial findings from that, talk about some recent developments. The reintegration piece, I think, is important because I really want to highlight off the bat that I don't want any of this to be misinterpreted to suggest that I think that hallucinogens should be administered in correctional facilities. That's something that's been tried in the past, and I think the relationship of power and control that exists in those places is antithetical to the use of those substances. So I'm talking about ways that might be able to facilitate reintegration once people are out. I think it would be a lovely thing if that was an option, but certainly not looking at experimenting with hallucinogens in a correctional facility. And then when I talk about some of those possibilities for integrating therapy, I'm going to focus on what are sort of sometimes called third wave behavior therapies, mindfulness-based therapies. Most prominent are DBT and ACT. So spend a few minutes introducing those. You could spend a lot of time studying them. I just want to sort of put them out there as something that people could explore further if they strike your interest. So talking about that first wave, I think probably the most prominent study was the Concord prison experiment. Dr. Leary's using psilocybin in a correctional institution together with inmates. So quite a courageous thing. Not because he was taking them with the inmates, because he was taking them inside the correctional institution. So really some interesting stuff, and the initial findings were quite positive out of the Concord prison experiment. And I also want to talk briefly about sort of, I think, a little known chapter in psychedelics and corrections that took place in Canada. I'm Canadian from UBC, originally from Winnipeg. So interested in Canadian psychedelic history, and this is a bit of a darker chapter, maybe filed together with the experiments in Montreal more than some of the more positive stuff that happened in Saskatchewan and now in BC. So when we think about the Concord prison experiments, as I said, initially the results were promising. Rick Doblin went back and reanalyzed the statistics and found out that there was not a positive effect. But in interviewing Ralph Metzner, talking about why Timothy Leary was interested, is because he saw recidivism as really an incontrovertible behavioral index of personality change. I mean, there's a lot of other factors that play into recidivism, obviously, but it is a somewhat objective measure whether once people are released, there's such high rates of rearrest and reincarceration. A lot of those have to do with the insane probation practices. But nonetheless, if someone can avoid reincarceration, that's certainly a somewhat objective measure of change compared to maybe self-report. So I think it is an interesting index. And what Rick's conclusions were in summarizing what happened here is there was a lack of post-release support, so that there were some improvements as people left, they felt better about it, but after a few months, those effects dissipated. So a question came, how can we have more long-term support, and what kind of support might be effective for people who are emerging from incarceration? So also from the first wave are the Oak Ridge, also known as Pitangasheen, I wouldn't call them experiments so much as I guess clinical programs there, and really I think a dark chapter in the use of psychedelics. And this happened through the 70s in Ontario, what they called defense disrupting therapies, where they used LSD together with scopolamine and naked encounter groups in something called the capsule. You can find some stuff about this on the internet. Again, you don't hear about it that much, but it's really quite a fascinating chapter, and there's an ongoing class action lawsuit by people who underwent this therapy. So I think a bit of a cautionary note in terms of what we want to make sure not to do. So now moving on to the second wave. And so those are some of the initial studies from the 60s and some from the 70s. But just recently, there's been renewed examination of the potential for hallucinogens in this population. And most of it is coming out from epidemiological data. So it's not administration of psychedelics, but it's looking at how natural psychedelic use might impact correctional outcomes. This is a study by Peter Hendricks, who, interestingly, I met at the last Psychedelic Science conference, and I saw him presenting this as a poster, and we've talked and since collaborated, so it's just such a great conference for that, being able to establish those relationships. So this was looking at supervision failure, and I mentioned there's what I think is an insane probation system here in the U.S. particularly, which basically guarantees that a large proportion of people will be reincarcerated following release. And that's called supervision failure or probation failure, and that's what this study looked at. And the predictor variable here is hallucinogen use disorder. I think it's unfortunate that it had to be a disorder, but this is what was in the records that they could examine. And really, I think hallucinogen use disorder is a marker for frequent hallucinogen use. So I put disorder in scare quotes there. We have such a large sample, though, that even though there's only a 1% prevalence of hallucinogen use disorder in this study, it's still about 250 individuals, so enough to examine. And what was found interestingly is that when everything was in there, this disorder resulted in 40% reduction in recidivism. So people who had this disorder were 60% as likely. And what's fascinating there is if you look at, where's the clicker button? Well, there we go. If you look at some other predictors, it is better than a job. A job only gives you, I like my hallucinogen use disorder better than my job too, and I've got a very, I have a very nice job, so I can only imagine. But yeah, so it's about 70% reduction if you had a job versus 60 if you had a hallucinogen use disorder, and even marriage is only 90%. So don't worry about getting a job and getting married. Just get a hallucinogen use disorder, I guess. So as I said, I had the opportunity to meet Peter at the last Psychedelic Science conference, and that was awesome. And we worked together on this study that came from my dissertation data. And this is prospective data, so we were able to assess hallucinogen use um, before before they were released, and then follow them up using FBI records. And we found very similar results. In this case, we looked. One of my research interests is in intimate partner violence, also called domestic violence sometimes. So we wanted to see if it was protective for domestic violence, and we got some interesting coverage. I particularly like this one because I don't think people were taking Amanita, but it's good enough. Um, And so in this case, we had 300 inmates, all of whom had some form of substance use disorder. And in this case, we were able to look at hallucinogen use and hallucinogen use disorders. And there are 44% prevalence of people who had used hallucinogens, that's any lifetime use, and under 10% that had the disorder, which is just sort of a marker for more frequent use, I suppose. And here's what we found when we looked at any hallucinogen use. So these are survival curves. So these are the proportion of people who don't get rearrested for intimate partner violence. And what you see is in the hallucinogen users, about 75%, so only 25% got rearrested. Whereas in those who had not used any hallucinogen use, it was closer to about 58% survived. So a dramatic increase in the level of people who survived over time, and those are months. So we're looking at about 6 or 7 years. When we look at hallucinogen use disorder, which is again more frequent hallucinogen use, we see even more pronounced effects. So it's only about 10% of the disordered individuals, if we'll call them that ended up getting rearrested, compared to about 35% of those without the disorder. So pretty amazing effects. And I think what's so amazing about this is just naturalistic hallucinogen use. There's no attention to set and setting. We don't know how these folks used hallucinogens or what intention was. But even so, given that sort of messy presentation, we still see some pretty pronounced results. I also want to present some new research that we've done. This is unpublished, and this is with undergrads. You might think, why are you looking at partner violence in undergraduate university students, college students? There's actually pretty high levels of domestic violence amongst university students. One of the highest levels, it's a time when people have maybe more variety of relationships, so there's more opportunity to be engaged in a dysfunctional relationship or a violent relationship. But some of the highest rates are amongst college students, about 30%. I want to mention my collaborators here. That's Michelle Thiessen, Adela France, and Brad Bird. And so we collected from a variety of samples. There's the UBC sample where we had LSD, and this time we're looking at LSD. About 6% LSD use. That's Laurentian, where Adele's from, and they had 9% use. I was a little disappointed to see the higher use. I mean, UBC, to digress for a minute, for those of you who don't know, this is the first place where there's a record of psilocybin mushroom use where the mushrooms didn't come from Mexico in 1965. There had been some tourists, I think they were anthropology students at UBC, who went down to Mexico and saw the mushrooms. They came back to BC and they saw the similar looking mushrooms growing on the campus. They're like, hey, maybe those are the same mushrooms. They took them. That's the first time that outside of Mexico that mushrooms were harvested, psilocybin mushrooms. So despite that, we still had lower levels of LSD use. We also drew from Amazon MTurk, if people are researchers, an interesting way to recruit, and also from Reddit. You can see we were more specific in those recruiting, so we got higher levels of use. And one thing about this, we had a little more control. We could give a better battery of assessments. So we were able to start to look at some potential mechanisms of what might underlie the effects of hallucinogens for reducing violence. And when we look at LSD use, we see it's almost significant, 0.08. But when you control for alcohol use, because there's some students that just don't use anything, and then some who drink and are also use hallucinogens. So it can be confounded because those non-users cause cause us to mix up the alcohol and the LSD. So when we look at them both together, we see what we'd expect, which is an inverse relationship between LSD use, so less violence, and a positive relationship, highly significant, with alcohol use. So alcohol use associated with more violence, and LSD associated with less violence. And you can see it a little bit more starkly there. You see about 8% of the LSD users are engaged in partner violence, compared to about 12% of those who had not used LSD. So this is going across a correctional sample and now an undergrad sample at a fairly elite undergrad institution. So pretty good generalizability there. We want to see what can account for this. What's the mediator? And what we found is something called emotion regulation, which has come up in a couple of presentations. It's really exciting to see some of the other presentations here that have talked about emotion regulation as a promising mechanism for understanding the salutary effects of hallucinogens. So LSD use was associated with better emotion regulation, which is associated with less intimate partner violence, and it mediates it. So it improves people's emotion regulation. There's some samples of the items for emotion regulation. So I'm confused about how I feel is an example of poor emotion regulation. When I'm upset, I acknowledge my emotions. That's reverse scored. So that would be better emotion regulation. So it's mediated. And in the same study, we also asked people about some positive relationship behaviors. So I just want to, as a side note, look at negotiation, which is inversely associated with aggression and violence. And what we saw there is that in couples where both members of the couple had used MDMA, we didn't specify whether they used it together. I think you can infer that to some extent. But we see greater use of negotiation amongst the MDMA positive couples. And some examples of negotiation suggesting a compromise, show you care about your partner even though we disagreed. So some real, I think, promising data regarding partner violence and hallucinogen use. So the preliminary evidence, just to summarize, was mixed. Methodological problems, some very questionable therapeutic practices. But at the end, there was calls for more post-release support. Now we have newer data that suggests, yeah, this could be something that can help folks avoid violent behavior. But what type of support is optimal? And I just want to spend the last 5 minutes suggesting some options there. So I think the first thing we want to look at is, well, how do we characterize the psychedelic experience? That's perhaps a little redundant for this crowd. People know, but I love Alan Watts' description: concentration on the present, awareness of polarity. And those are things that really map on to these third stream behavior therapies. Map on really remarkably well, even though these therapies were developed, a good 20 years subsequent to Alan Watts' observations. So when we talk about behavior therapy, we have, your B.F. Skinner. I wanted to make sure that B.F. Skinner's picture was up some point at the MAPS conference, so I took that on myself. There's B.F. right there, forefather of psychedelic. No. And then the second stream is cognitive therapy, that's sometimes called CBT, but really emphasizing thoughts. What I think is interesting about the new wave is it's more about acceptance. It's not so much about changing your thoughts or replacing them. It's about developing a different relationship with your thoughts so that you're able to observe them, notice them, and then return to value-oriented behavior. So it's a focus on the cognitive process of how you relate to your thoughts rather than what's in your thoughts. So that's sort of the big change in these third stream therapies. As I mentioned, ACT, DBT, and also mindfulness-based cognitive therapy are some of the most prominent versions. And I'll just talk real briefly about them. If this seems interesting to you, I really encourage you to look up more. There's lots of good stuff on the internet. Marshall Linehan, the founder of DBT, probably the most prominent of these mindfulness-based therapies. And it's a dialectic. So it's a balance between change, which draws heavily from Skinnerian and subsequent behaviorists, and acceptance, which draws from Dr. Linehan's own Zen practice and an acceptance of duality. And what's really emphasized in the dialectical behavior therapy framework is wise mind. So through an integration of rational thought and emotional thought, you can come to a wise mind where you're able to follow your values and observe your cognitive processes. And it's so encouraging. There's a presentation by Jordi Riba yesterday where he talked about in Brazil, there is actually getting some government funding to do a study of mindful practices with psychedelics. So that's really what I'm calling for here. And I was just fascinated to see that that's going on. So that's terrific. Also, Claudio Naranjo's talk yesterday, he talked about moving away from overemphasis on rationality and reason and being able to integrate that child mind or the inner child. And so I think that speaks to this integration a little bit. We'll talk briefly about acceptance and commitment therapy and psychological flexibility, being in contact with the present moment, and also being able to persist in value-driven behaviors. And in ACT, they talk about inflexibility. Won't go into this too much because I want to leave some room for questions. But in inflexibility, you're dominated by avoidance, by being entangled with your thoughts, really not being able to separate, being fused with them, and that leads to suffering. Whether, in contrast, psychological flexibility, being present in the moment, being accepting, being diffused in your cognition, so you realize you're not your thoughts, you're just something that's going on. And, I think that what the psychedelic experience might offer is a chance to touch some of these experiences. So if you're a doubter, if you're someone who hasn't had the opportunity, and there's, doubting Thomas touching the wound. So maybe the psychedelic experience can allow us to have those experiences and help with reintegration that way. And I think I have time for a question or two. Thank you very much.
Thank you. Great talk, and kudos on the Skinner
Thanks,
point.
Matt.
So I know in the help Peter with the recidivism paper, and I know we got it was reported, of course, that without controlling for covariates, there's an increase.
Mm-hmm.
The association was for psychedelic use or dependence being associated with an increase until you control for those covariates, and that's to be expected given the very large association between the use of any illicit drug and other illicit drugs. So I think it's justified, and
Can I remind you,
correlations.
What's your question?
Yeah, I'm getting there. I'm getting there. Did you control for covariates in the new undergraduate? You mentioned alcohol, and I'm wondering whether any other ones were included.
We controlled for alcohol, and that's when the effects were more pronounced. When in some other analyses, they came out even without controlling. But we also controlled for antisocial personality disorder, and that increased the antisocial personality traits, I should say, and that increased the size of the relationship as well. So there's that whole impulsivity, rule breaking that is associated with using any kind of illicit substance, and that's going to lead to be associated with increased violence. So when you control for that, the effects of the hallucinogen become more prominent.
Did you look at basic demographics like race, ethnicity, and things like that, or maybe it was pretty homogenous?
Well, we looked at a variety of covariates to see if we saw those initial bivariate relationships, and if we did, then we controlled, and if not, we didn't.
Great.
Thanks.
Awesome.
Sorry. Thank you. So I'm curious because emotional abuse has been shown to be more damaging to the victim than physical abuse. You only tested for physical violence. Is it possible that psychedelic users could still be just as abusive as regular populations? However, perhaps they are more prone to emotional and mental abuse rather than physical?
That's a great question. And in the undergrad sample, we didn't have those data for the correctional sample, but when we're looking at the college students, we had one index that was just physical violence because some people like to operationalize it that way and say you either hit or you didn't. But we also looked at psychological abuse and saw a similar pattern of results. So it was a reduction in general partner aggression, whether it was physical or psychological. Great question.
Hi there. I'm curious, given the success of the Vipassana program in the prison system, at least on a small scale, it seems like these types of things could be really effective in the right set and setting. I'm wondering what your thoughts are on the failure of the first wave experiments that Dr. Leary did. How much of that was about the set and the setting, and how could that be changed in today's prison environment, especially given it's a for-profit system at this point?
The set and setting in a prison is appalling. So I can't imagine, or at least the setting. I mean, the set you could be be able to overcome that, I suppose, and some folks are, as the Vipassana shows. But I would be reluctant to advocate for it, given the deep dysfunctionality that I see in the correctional system. So I'd rather just get people out than. So I see the possibility for that, but as my own perspective is, I'm not a big fan of incarceration-based interventions because I just don't like the communication that, hey, look at all the great things that we do for people in jail. We should get people out of jail, period.
So you think even if the therapy was in a set and setting room, for example, just the broader set and setting of being in a prison system would just undo any benefit?
That's my gut. I mean, it would have to be a heck of a room.
Yeah. Okay, thanks.
Thanks.
I'm interested in the aspect of emotion regulation, and reading recently the book on a Good Day. She discussed that 67% of hospitalizations for women occur the week prior to their period. And I would suspect there might be a correlation to maybe arrest and imprisonment, and I wondered if you had looked at that in terms of emotion regulation and how that might be a mitigating factor.
I think that's a fascinating, I mean, that could be a whole field of research to look at, temporal differences in emotion regulation. And there's such an industry now around medication for what in the new DSM, what is it?
PMDD or something.
Yeah.
I think it would be interesting if that could be a focus of some of these medications helping with those, because I was surprised to find that 67% of women are hospitalized a week before it, but it makes sense in terms of how it's not researched very well.
Yeah, and another topic in women's health that deserves a whole lot more research. Absolutely. Thank you. Thanks a lot.
Thank you very much.